Brazil. Thank you so much. I give the floor to Mrs. Aguirre. Thank you. Good afternoon. Thank you so much, Jose Maria. Can you hear me? Everyone, can you hear me? Yes, we can hear you. Yes.
This panel in a mix of English and Spanish. I am going to kick up the panel in English, but this is like the type of richness of the presentation we are going to have. I cannot be more happy to be in this event, and I appreciate a lot the UNODC to allow me to be in this panel to share these fantastic interventions we are going to have. As you can see, the panel is called the Gender Perspective in Crime and Drug Statistics. Here is very important, and I am going just to start giving two ideas that will be important to frame the discussion we are going to have. I think it's very important to consider that gender is not only a variable that we add to crime and drug statistics, like race, like location, but it's important to consider this as a way to think policies. We can only track interventions when we are properly measuring the interventions. We are going to really identify the risk and the characteristics of violence and drug issues in relation with gender. But it also opens a way of thinking on a transactional perspective. Secondly, that we are going to think on here on gender, not only as a need, not only as a requirement, but as an opportunity, as I said, to really capture these manifestations of violence that are sometimes hidden and unattended. So here I am going to open the floor to the panel we are going to have. It's an amazing group of women from all around the world, from all around perspectives that would provide us a very rich discussion. We are going to start with Alejandra from INEGI, and then with Cristina from the European region, talking us about how they are facing challenges and how we are identifying ways to include gender in several topics. Then we are going to move to South Africa with Romi, that is going to talk more in detail on drugs, closing with a discussion on drugs in Latin America by Viviana Porto. So we are 400 people here. We are very happy to have this floor. We are going to have 12 minutes by each of the discussants and half an hour to talk. I have a round of questions prepared by myself, but I am going to revise the Q&A session to organize the questions for you. So don't forget that we are going to mix of English and Spanish. So please check your translation. Also, you are going to be able to see this recorded in YouTube, but also be very active in social media. We have Facebook and we have Twitter, where you could put your comments and everything. So we are going to start and give the floor to Alejandra Ríos, Deputy General Director of Development, Analysis and Government Indicators at the INEGI Mexico. I am not going to go deeper with the bios of each one that are provided there in the chat. She's going to talk about the challenges to solve bias on statistical information on crime in relation with institutional problems in Mexico. So Alejandra, you are very welcome and thank you.
Thank you very much, Katherine, and thank you, everyone. As a previous agreement with colleagues from this panel, I will switch to Spanish, but I'm happy to answer any question in English. Bueno, muy buenas tardes a todos, a todas, por acompañarnos el día de hoy en este panel. Voy a compartir pantalla en un minuto.
In 1 minute.
Me parece que ya está.
I think it's there, right? Can you see it? Thank you. Ready. Thank you so much, everyone. The intention of my presentation, more than emphasizing particularly on the Mexican case, I want to do a generic invitation, especially some general challenges and opportunities, as Katherine just mentioned. Let me start out by reminding you that the gender perspective means we have to recognize relations among human beings are permeated with the condition and the attitudes that because you're a man or a woman. So the gender roles determine expectations and behaviors of human beings in all facets of social interaction, and the crime, that is criminal situations, in fact, are relations and social actions. So there's no reason for which we should say that they're not permeated as well by the conceptualization that we have built on the role of women and the role of men as well. So that's why we can talk about gender violence against women. That is violence where women are the victims. The causes of their victimization have to do with gender stereotypes. We could also talk about gender roles and how they generate patterns of criminality. In compared terms, when we look at literature, we see that work has been done, analytical work, very broad on violence of gender against women more than on the causes. And why is it that a woman commits a crime? Existing analysis on this issue usually focus on more developed societies as shown by literature, by Cushley, identifying three different ramifications. Analysis identifying general pathways to crime. This is the most important factors for women committing a crime. The second one is the importance of the social context, the context that make women commit crimes. And then the third one is interiorizing gender stereotypes and how this has an impact on women committing crimes. So please bear in mind these three different pillars, because that's what we should be discussing when we talk about criminal statistics. When you look at this academic analysis, we see that most of the references come from qualitative analysis. This is analysis using disaggregated statistics by gender or by sex. This means that the creation of those criminal statistics are mainly concentrating on the behavior or the study of men and the analysis, whereas the analysis on women is usually as a contraposition on their behavior. So in this logic, in a very correct manner, in a general vision, Caroline Ganado Perez has mentioned how the statistics are usually focusing on men's behavior, and this results in making women invisible. In terms of the analysis of crime and criminal behavior, this takes place in women that commit the crime, but also women as perpetrators of crimes. As it's of course obvious, this has many consequences on the design of prevention, attention, and sanction public policies. So what I want to do in my presentation is to say that in terms of crime statistics making women invisible, this is a recurrent thing happening in terms of drug trafficking, and I think this is even more related to my colleagues' presentations. This is the invisibility factor. For instance, Newman of British Columbia University says how the analysis of the war against drugs in North America is mainly concentrated on men. This is a partial analysis of the phenomenon because it leaves women out as consumers and direct victims in this problem, as well as their participation as market agents or agents in the market of illicit drugs. Why is this happening? There are different hypotheses on this, but I wanted to talk to you about three of them. Basically, the bias in the production of data with a gender perspective comes from three generic problems that are confronted with countries with very weak democracies and without the public servants um, method. And this, of course, has a greater impact. The first one has to do with institutional weakness affecting the constitution of statistical systems of organizations. The second one is an institutional coordination problem in terms of public security institutions, as well as law enforcement institutions and the penitentiary system. The third item, obviously, has to do with stereotypes in terms of the construction of the systems used to systemize data and regardless of the fact that those stereotypes are permeating social relations. But let me start out showing how disaggregated data allow authorities to create responses or special care within a gender perspective and the incorporation of the gender perspective itself. Let me give you two examples of this. The first one, and this is the one you see on the screen, comes from the National Survey on the Dynamic of Households. This is 2016 information. This is the national surveys where women interview women, and this is what they're talking about, violence against women. You can see on the screen that out of 17,313,000 women over 15 years of age that have experienced a situation of physical sexual violence in the community sphere throughout their lives, only 6.5% requested support, information, or services, or they filed a complaint before an authority. Those that didn't look for help or that didn't file a complaint, and this is something this where data become very important, 49.5% said they didn't do it because it was something they believed to be unimportant that didn't affect them. 15% didn't know how to file the complaint. So 9% said that they didn't do it because they were ashamed. So this is telling us that the institutions, law enforcement institutions still have a long ways to go to facilitate women who have suffered violence the possibility of getting help or trying to get justice protection. Data indicate very clearly that focalized strategies are necessary to disseminate the institutional offering in this type of situations, and also the integration of these women in the protocol institutions so that they can be taken care of to attend to violence. This means that eliminating this type of violence based on gender roles is not it doesn't go through normalizing. This has to be a systemic task. And the second example I wanted to show you comes from the National Survey of PPL and 2016. And here what I wanted to show is how disaggregated sex information allows us to understand the need to have interventions with a gender perspective. 94.9% of the PPL population in Mexico in 2016, men, and 5.1% women. This allows us to go into greater detail on those people. Taking as a reference the total amount that I've just mentioned, the percentage of women with daughters, with children, is significantly higher than men, 86.7% versus 73.4%, which is the chart you have on the left side of the screen. Now, according to the same survey, 2016 survey, 70.3% of this population had an economic dependent before being detained. But if we just consider the figures of the number of children they have, people who depend on this woman, we have substantial differences by group, by age groups of this population. 89% of the women who are in jail have children who depend on them economically. 62.9 of the men have those types of dependents. You show this age group distribution and sex distribution as well. In the bottom, you can see there, when we go into the judicial process, we see the percentages of women who are convicted are higher figures than with men. This shows that the percentage of women that are in jail, this is greater than anywhere else. In the qualitative analysis, we know that one of the factors women face in terms of their freedom is abandonment of family circles, unlike husbands, where the mothers and wives usually have to support the men in jail. This is different with women in jail. And the sentences or the convictions are longer, or because there are more women without convictions, more women without convictions in jail than men. They have no money to pay for their own defense. They don't have any family support to pay for any of those services. In drug trafficking here, what we have, according to the national census of law enforcement, we see the number of women because of drug peddling increased between 2017, 2019, but the case of men, it was 46.4% in the same period. This makes sense, and it is consistent with recent analysis in the United States and Canada showing that the women are the women with a higher percentage in terms of the growth because of drug possession or drug trafficking. So we see the number of women growing and the percentage of women accused, they go to jail, and the percentages of women in jail give us these results. Now, we know more from the surveys than from administrative records through the disaggregation and the incorporation of an authentic gender perspective. What do we have to do to incorporate the gender perspective in this regard? In principle, considering institutional capabilities of law enforcement agencies and the penitentiary services. This is very important. This is organizational, but also it also has to do with the budgetary situation. So we suggest incorporating key variables to identify individual elements, contextual elements as well. Why is it that women are committing those crimes? We have to include the gender perspective in this. I'm about to conclude. The second challenge is to foster institutional cooperation among government agencies and some federal structures. There has to be an intergovernment coordination as well. This has facilitators or actors. You see here on this chart what we're doing in centers of excellence, but also national institutions or national statistics institutes. And thirdly, of course, doing away with stereotypes in the organizations themselves. This is a major challenge because the justice and security areas have their own biases, a gender bias, of course, and that is something we know. Let me conclude by saying that the causes and the impacts of violence are not alien from gender stereotypes. We have to remember there's a gender component to reduce violence. We have to remember this, especially violence due to illicit trafficking of drugs. And in this sense, gender should be understood as the structure of power structures more than an individual attribute or specific role. That's why it is fundamental for us to have systemic actions that will allow us to understand biases of violence. And this has to do with documenting those biases and that violence. So if we're talking about narco trafficking, we have to stop making women invisible and their role as victims, but we also have to look at the role of women as perpetrators of those crimes. I think I have used all the time I had. Thank you so much.
Alejandra, you did an amazing, important intervention to really provide us like a conceptual perspective on why we need this data and try to change this idea that I introduced at the beginning, that gender perspective is not only to add the gender variable to the data, but also considering where women are more vulnerable and why we need to develop policies to attend the vulnerabilities that only can be identified when we have the data. So thank you, Alejandra. This conceptual and the evidence you provided is key for the rest of the presentations. I am just going to highlight that the presentations are very aligned, and we are going to continue talking about the problem of drugs across the presentation. So this opens the floor very properly for the intervention of Cristina, the coordinator of the gender-based program of the European Institute of Gender Equality. You have there in the panel the full description of Cristina, and she's going to talk more in practical how this has been developed in the European Union. Thank you, Cristina. You have 12 minutes, 15 minutes.
Thank you, Caterina. Gracias a todos. Thank you for giving me the opportunity to.
Gracias por darme la oportunidad de presentar el trabajo que está
On specific forms of violence against women, such as intimate partner violence, rape, and femicide in the European Union. So I'm going to share my screen. Now, yes, right?
Yes, it is starting.
Yes, thank you. So administrative data stands at, oops, sorry. Administrative data stands at the beginning and at the end of every policy-making process by informing policy planning with knowledge of the phenomenon, as well as monitoring changes in response to new policies and evaluating the effectiveness of these policies. But unfortunately, data on intimate partner violence and femicide is generally poor. EIGE started its work on data collection in 2012, and mapping all data sources and data collection methodologies in 4 sectors, the police, justice, health, and social services sector. And we decided to focus on the police and justice sector, and to develop an uniform set of definitions and indicators to aid the national data collection on rape, femicide, and intimate partner violence. The indicators that you can see on the slide were published in 2017, and in order to provide a comprehensive picture of the gender dynamics of violence against women, and the institutional response, we decided to include the 3 units of measurement. So we had a number of victims, number of offenses, and number of perpetrators, and then we had the indicators break down by the specific form of violence: physical, psychological, sexual, economic violence, intimate partner violence, then rape and femicide. These 9 indicators were for the police sector, and then we developed 4 indicators for the justice sector, and we were aiming at measuring the number of protection orders issued and granted, the number of perpetrators prosecuted, sentenced, and held in prison. The first data collection was carried out in 2019 and 2020, and the data has been analyzed and made publicly available on EIGE's gender statistics database. By clicking on the indicators and the gender statistics database, it shows the data tables with data for jurisdictions that were assessed as comparable. So you can see here the table that it looks like pretty empty. So we decided just to display data that was assessed as comparable. But information on data available at country level but not comparable can be also downloaded from the metadata tab in the gender statistics database, and which provides the user with more in-depth information, including a table with links to individual country data collection tools, and also comprehensive metadata. The assessment of the data shows that data on the age of the perpetrator and is the least collected. So only above around 30% of the member states collect data on the age of the perpetrator, and this is followed by the sex of the perpetrator and the age of the victim. So sex of the perpetrator is collected around 40% of the member states, and the age of the victim is around 50%. So data, it's not kind of very perpetrator centered, and also not perpetrator accountability. It's one of the principles of this data collection. So if we see here, one of the main challenges was the use of the counting unit. We can see that 18 member states could provide us with data on the counting unit, the number of victims, although 17 member states could only provide data on the offenses, and also 6 member states could provide the proxy data on offenses such as reports or cases. Then we had that 17 member states, so it's a little bit more than half of the member states could provide accurate, not absolutely accurate, by data on the victim-perpetrator relationship. and 22 member states could provide sex disaggregated data of the victims. When we are talking about victim-perpetrator relationship, we can see that the scope of the understanding of what includes intimate partner, varies a lot across the member states. So we can see that, for instance, in Czechia, intimate partners are the persons who are living in the common dwelling. In other countries, former partners are not included in this equation. So let's say that the victim-perpetrator relationship it's not systematically recorded, and that it's needed kind of a standardized, predefined categories, hand in hand with a mandatory recording and training on these categories that would lead to an improvement in the availability and quality of the victim-perpetrator relationship data. EGE also developed this indicator number 9 on what we call the intimate partner femicide. And as I mentioned, we face the same challenges. So only around 4 jurisdictions out of the 30 EU jurisdictions, including 3 from UK, that had comparable data on intimate partner femicide overall. So this is a 40% of the member states, the ones that are in green in this map, and so less than half. So despite the magnitude of the problem at the European Union, data is not yet systematically collected, and there is a worrying lack of knowledge and understanding of the gendered dimension of the intimate partner violence and the killings of women and girls because of their gender. So we can see that the main problems that we are facing is that the data is mainly incomplete. So then we were also having like a lot of problems regarding the accurateness of the data, the comparability, but the main problem we see that it's in the completeness of this data. The reasons why this is so incomplete we can say that it's one, it's related to the different definitions for specific crime types in different countries. So the category in which any incident of victimization is recorded relies on the legal definition of crime in each country. No? So this is particularly problematic when we are talking about crimes that require some discretion from the police officer or relevant authority when the crime is identified. So for example, the definitional differences between serious or less serious incidents in different legal jurisdictions may be different, and this is reflected then when recording the incidents. Here I'm referring mainly to the specific problem on the misdemeanors. So when we were collecting data, we were collecting data based on the ICCS for sure, but we were discussing whether to also collect data on the misdemeanors. We decided not to do so, although we saw that in some countries there were a huge amount of data on the misdemeanors, not related to violence against women, and we know by the research that what we say that these less serious incidents can precede a killing. So that this is one of the problems that we are facing as well. That we are in a sense we are kind of minimizing incidents on the violence against women, that incidents that can lead to the killing of the women, and in a sense they are also preventing us for having like a more kind of targeted and effective preventive measures. Then we see that there are the definition also of an intimate partner violence. Only in 2 EU member states there's a legal definition of intimate partner violence. In other member states, most of the data was collected under domestic violence offenses. This also leads to another problem that it's very difficult then to disentangle the relationships and also to cross-reference the sex of the victim and sex of the perpetrator. We see that another problem regarding the completeness of the data is that the data on the victim-perpetrator relationship is not systematically recorded. And as we were saying, that we are using different units of measurement or counting units. So we saw that data it's available in a lot of member states, although it's not it consists on non-comparable data. This is resulting from these differences in legal definitions and also in the mapping that the member states can do regarding these legal definitions. For instance, we saw that when we are analyzing economic violence, it was very difficult for the member states to agree on the scope and understanding of which offenses can fall under the definition of economic intimate partner violence. So in a nutshell, what hampers the collection of data in the EU member states are mainly referred to the data disaggregation, so variables that can, in a sense, show us the dynamics of the violence. So it's not only the sex disaggregated data, but we need data on the intimate partner relationship. We need data on different units of measurement to really see these dynamics. We need to have like a good understanding of what we understand by intimate relationship, and then we need to have like good national data collection systems with that allows to have data integrated and that the coordination across the different databases. So EIGE now is planning to launch a new data collection on these 13 indicators in 2022, and we will see which is the progress that can be made in the European Union regarding the collection of data in this regard. So thank you very much.
Okay, Cristina, thanks a lot. This presentation really shows us that when we have the idea and when we have a real perspective gender violence approach, it is possible to collect the information. I think this is the most important thing that provides your presentation, Cristina. But we also need to be kind of critical on the fact that these are developed countries. No, we are going to think on how can we adapt and how the realities of a region like a Latin America or like an Africa, we are going to be able to capture and to overcome all these administrative issues. If you highlight administrative issues in Europe, I could imagine how could be in a region like Latin America or Africa. So thinking about these regions, that give us the perfect floor for the following presentations, starting with Romi from ENACT program of the African Institute for Security Studies. She's going to go deeper on the topic of transnational organized crime, including topics of drugs abuse and the involvement of women on illicit drug trade. So we are going deeper in the specific topics that we talked at the beginning, and with this very important regional range that we were able to put together in this presentation. So Romi, you have 15 minutes, and we appreciate a lot of your presentation.
Hi, and good afternoon to everyone. So I'm going to be talking this afternoon on the gendered impact of the dissonance between drug statistics and policy in Africa in general, and then use individual countries to illustrate some specific examples. So the first thing to say is that there really is a patchwork of statistics across Africa when it comes to drug use. There's no consistent, regular collection of data on people who use drugs across Africa, which is very clearly illustrated by the missing information. And although it's very small, if you look closely, you can see the difference between the lower and upper ends of the estimates in these tables from the UNODC World Drug Report in 2020. So many of the stats that do exist on drug use come from registered treatment centers, and even then, not all of them. And they focus on the number of people treated at the particular facility, which of course precludes all of those who do not access treatment. In South Africa specifically, there's only been one nationally representative study of alcohol, drug, and psychiatric disorders, which was carried out almost 20 years ago now. The South African Community Epidemiology Network on Drug Use have the most comprehensive statistics, but they are only collected from 70% of the government-funded and private rehabilitation centers in the country. And if these are the missing stats per the general population, the paucity of information is even greater when it comes to gender disaggregated stats. The Global Burden of Diseases, Injuries, and Risk Factors study in 2010 acknowledged that there's considerable uncertainty around regional estimates of drug dependence among women. And this is exacerbated again and to an even greater degree for subpopulations, such as women who have sex with women, transgendered women, women who belong to racial and ethnic minorities, and young women. And the disaggregated stats that do exist on drug use often focus on specific subsets of women who use drug, such as HIV prevalence among women who inject drugs, or those who come into contact with the criminal justice system. And while these subsets provide useful snapshots, they're not usually generalizable to the population as a whole, and they may miss broader trends across national contexts or more localized nuances, for instance, across provinces or specific areas. So some of the disaggregated stats that do exist from South Africa, as you can see on this slide, come from much smaller, very specific or localized research studies that can't really be extrapolated to the rest of South Africa as a whole. So why do we need a more comprehensive and holistic approach and the numbers on gender disaggregated numbers on people who use drugs? Well, I think the most important thing is we cannot work with what we do not know. So data about women who use drugs is essential for planning and allocating resources for integrated services tailored appropriately to meet their needs, because as we know, many of the health effects of drugs are gender specific, and many treatment approaches do not take into consideration the socioeconomic impact on and consequences for women. So women fear disclosing drug use for various reasons. The first is the risk of stigma, not only from their families, communities, and society in general, but also from health professionals, including those who are involved in providing harm reduction services. And in fact, qualitative studies have consistently found that women face greater stigma for drug use than men do. There are also wider social expectations around womanhood and the role of women in communities, such as childcare responsibilities, domestic obligations, and often the need to earn money to provide for their families, especially if they belong or are the heads of single parent households. There's also the issue of gendered sanctions, which includes the threat of having their children removed from them. So this sets up a vicious cycle where there's a stigmatization of women who use drugs, which leads to the unwillingness among women who use drugs to admit the problem and access treatment. Because of this, there's a lack of data on women among people being treated for drug disorders or drug use, which again leads to a lack of understanding about women who use drugs, which leads to poorly conceived policies and practices for women who use drugs, and a deficit of services, which feeds back into the stigmatization of women who use drugs. The other aspect to this is there are huge gaps in our gendered understanding of the dynamics of illicit drug markets in Africa. So the gender disaggregated information on those involved in drug trafficking and the illicit drug trade in general remains very scarce. One of the problems with collecting accurate data on women involved in drug trafficking is the criminalization of drug use in general. So the criminalization of drug use drives into greater interactions between women who use drugs and law enforcement agencies and officers. Drug use is also exploited by police officers as justification for abuse, with aggressive policing techniques that include arresting women for carrying injection or smoking equipment, planting drugs, harassment, soliciting bribes, sexual abuse, and violence. On top of this is that prison systems typically lack gender-sensitive policies, structures, or staff, and women are often subject to sexual violence in prisons and lack access to drug treatment, sexual and reproductive health facilities. Men are consistently prioritized for prison health services due to the larger number of men incarcerated, and therefore the greater urgency and cost effectiveness of providing services to male prisoners. But this is often linked again to not understanding the number of women who are in prison for drug use or those who are involved in actual drug trafficking or the drug trade. So what are some of the advantages of having policies and programs that are rooted in accurate data and evidence-based research? So the following are a couple of case studies, one on a national context and one on a much more local context, which are illustrative of what can be achieved if gender disaggregated data is collected, analyzed, and used towards developing more gender-sensitive approach to women who use drugs. So in Egypt, since 1994, the National Addiction Research Program in Egypt has been conducting cross-sectional descriptive community-based studies across 26 of the 27 of the Egyptian governorates. And the gender disaggregated data collected in these studies over the years has shown a marked increase in the prevalence of drug abuse among women in Egypt. So to respond to this, a dedicated facility for women was established within the premises of the Heliopolis Addiction Hospital. And the goals of this facility were to build capacity for staff to provide gender-responsive care to women suffering from drug dependence. And this was through a range of initiatives, but the one of which was particularly important was holding regular meetings to, among other clinical issues, discuss the evidence-based research on gender-related topics related to women who use drugs, such as the physiological differences of substance abuse in women, the impact of relationships on the development of substance abuse, codependency problems, risk factors such as trauma, anxiety, depression, eating disorders, the impact of substance abuse on menstruation, pregnancy, labor, and breastfeeding, the correlations between substance abuse, sexuality, and violence, the challenges and obstacles faced by women to accessing treatment, and then compliance to programs. They also wanted to develop policies and guidelines to establish gender-responsive drug dependence services nationwide, and to start up and assess a public domain addiction service for women, which serves their specific treatment needs to high standards. And just a couple of the highlights from an evaluation of this treatment facility is that treatment uptake by women increased significantly. New outpatient cases increased from 5 to 249 cases, and follow-up outpatient cases increased from 28 to 470 within 14 months of establishment. Importantly, requiring parents' or husbands' consent before admission of female addicts decreased, irrespective of the age group of the women, which reflected in a shift to reinforce the female addict's right to receive treatment of her own volition. The facility also improved its ability to strike the right balance between providing treatment while allowing women to meet their family obligations. And this is a key conflict issue that hinders many women from seeking and then complying with the treatment program. And the program was able to sensitize many professionals in various specialities to the specific needs of women in treatment and how to support them. So some of the important lessons that came out of this treatment facility and this program included that gender sensitive and responsive services was both adaptable and culturally acceptable to the Egyptian females and effectively addressing their needs. That long-term psychosocial support, rehabilitation, and follow-up were recommended. that an inclusion of a special section on gender issues and national substance abuse strategies should be clearly articulated for long-term sustainability, and then amending legislation regarding child custody and child protection concerning women who use drugs is crucial, because it can open the gate of hope and opportunities for women to be reunited with their children after recovery. The second is a more localized case study from Kenya in Mombasa, where the Muslim Education and Welfare Association, MEWA, partners with Mainline, which is an organization that aims to improve the health and human rights of people who use drugs, under a program called Bridging the Gaps. And MEWA's 2016 records indicated that approximately 1% of the clientele at their drop-in drug treatment centers was female, which was less than 20 women. But observation from peers and outreach workers in Mombasa's drug dens indicated that actually a higher number of women who were using drugs who were not accessing services. So MEWA undertook the following. They conducted a 2-month research study to gain insights into the service gaps and needs of women who use drugs in Mombasa. And then they established women's only hours at the drop-in center with female outreach workers, discreet access to the services, and short-term childcare services. The women who came to the center received a transportation stipend when needed and were provided with food, clothing, and hygiene products, as well as access to shower facilities. They also received testing for STIs, as well as basic health checkups, wound care, and counseling. And those with specific health needs were linked to relevant health facilities. If there were any homeless women who tried to access services, they were housed in a temporary residential center for women that prioritized women with children and those that needed medical attention. And in 2018, the project also introduced prenatal, delivery, and postnatal care, as well as delivering psychological and social support. And also in 2018, a training manual on how to reach women who use drugs was developed, and further research is now exploring female-specific needs and interventions in the Kenyan context. So again, some of the positive results of this initiative have included having a female-friendly harm reduction approach proved successful in bringing women out of hiding. By the end of 2018, MEWA had reached 390 women who use drugs in Mombasa and Kilifi, as well as a further 200 women who accessed additional sexual and reproductive health services, such as condoms and contraceptive methods. Family ties had been restored in some instances, and the community was starting to gain an understanding of some of the issues surrounding women who use drugs. Some women were also empowered with knowledge and skills. At least 12 women were able to start up small-scale businesses through the income generating skills and entrepreneurship program that were implemented since 2017. Importantly, MEWA nurtured a bottom-up approach whereby women who use drugs were involved directly in the design, implementation, and evaluation of both the pilot and the continuation of the project. So just to highlight a couple of recommendations that are coming out of this presentation. And the first step is to routinely and regularly collect gender disaggregated data on drug users, on women who are drug users, women involved in drug trafficking and the drug trade, and women imprisoned both for personal drug use as well as for drug trafficking. A second step, though, is it's important, especially around women who use drugs, to flesh out the numbers or the statistics with some qualitative data. So just having the statistics on drug users can also dehumanize the very women whose those stats are meant to help. It can limit and censor their voices and narratives. So the result can be services or treatment options that actually ignore nuance, contradiction, and the very uncensored, disturbing, complex, and uncomfortable reality of the lives of many women who have been exposed to using particular drugs in particular ways. For women involved in the drug trade, we need in-depth data on why women become involved in drug trafficking through coercion or being recruited as drug mules or because of their vulnerable socioeconomic state, how the drug trade affects women's security, and about how women's experience of accessing justice for drug-related crimes or social and medical services for drug use. And then a third step is to meaningfully involve women who use drugs and women with direct experience of drug addiction in the design, implementation, and oversight of relevant research, policies, and services. And of course, for this, sufficient resources are needed for developing policies and providing services that are effective, comprehensive, gender sensitive, and adapted to the realities of women who use drugs. So services need to provide women with a safe space. They need to be non-stigmatizing and accepting, and they need to be flexible in order to allow women to access services that suit their responsibilities and incorporate elements such as childcare without the threat of removal. And I think I'm pretty much at time. So with that, I'll wrap up and say thank you.
Romi, thank you. I cannot repeat more about the richness of this presentation to allowing to have this broad perspective of different vulnerabilities of women across regions is very important. And I found very interesting from the presentation these practical interventions that were focused on the real vulnerabilities of women related with drug abuse and regarding all the markets of drugs in Africa. So this opens the floor very properly to Viviana. She's going to talk about how we need to talk about new metrics to new perspectives. She's going to focus on the topic of drug policy, recognizing that we have a punitive and a traditional perspective to drug policy, and how introducing the new indicators is the way to push this new policy, and how the introduction of gender is the real opportunity to change this punitive-based perspective to a more progressive, related with public health, with human rights guaranteed and everything. So Viviana is a student, a PhD student of political and social science at the UNAM University, former researcher of Igarapé Institute, and she's going to give us this latest session, this latest presentation to continue discussing about this topic. Thank you.
Bueno, gracias, Katherine. Buenas tardes a todos y a todas.
Good afternoon to all of you. Good evening to all of you, depending on where you are. And I am going to share my screen now.
Bien. Bueno, les voy a compartir un trabajo, a ver si está apareciendo. Sí. ¿Qué es la actualización?
This presentation is an update, a research that was elaborated previously by the Igarapé Institute in 2014. This work is the response for the global call for drug policies to measure effectively drug policies. So at the Igarapé Institute, they wanted to have a progressive agenda to take into account the different needs of countries. In this agenda, we are including 86 measurements based in scientific evidence of what is really working regarding drug policies, but it doesn't have a gender perspective. So that was the idea, to update this work in order to include the gender approach, in order to have more efficient measurements and more accurate. When we talk about drug policies, we need to understand how the international drug regime is comprised, in which this policy is based. So the purpose of this legal framework is to implement control measurements at international level in order to have drugs for medical purposes and to control the flow of drugs towards the illegal market and to prevent drug trafficking flow. We have a single convention of narcotic drugs, 1961. This is a convention that comprises 50 years of debate and international policies since 1909 in the Shanghai Conference on Opium. And on 1971, as a response of the emergence of new design drugs and synthetic drugs in the decade of the 60s, they included at this control substances. And they have 4 different types according to the potential risk of their use. On the other hand, the Convention on 1988 against illicit trafficking, narcotic drugs and psychotropic substances, they have 2 lists: precursors, reactants like iodine, ethylic alcohol, to control the international drug market. It is also created as a response to drug trafficking. One of the differences between this convention and others is that this strengthened the obligation that countries have in order to prosecute others. In prosecuting responsible people, other conventions were not considered in. And here they are considering also the use and the possession of drugs. So countries were able to prosecute drug consumption and drug possession. The purpose of this convention was to decrease dramatically the offers so the price of drugs could deter the users. And we know now that this didn't happen. However, December last year, as a request from the WHO, they consider the most dangerous drugs in list 4. They are including the most dangerous drugs. In this convention, they have mentioned that when there is a new drug and their therapeutic value or their potential risk is not known, it's going to be included automatically in list number 4. So cannabis was removed from this list, and they were able to recognize medical properties of this drug. So we have an open channel here to look for new models for drug policies to control drugs, besides all the conventions that have been already signed. And why do we need to have new measurements? First, the debate of drug policies, taking into account all these conventions, is controlled by a punitive approach. Traditional indicators reflect this approach, and it was made to undermine the so-called war against drugs. So this is a punitive approach based on the fact that all the stakeholders are going to be sent to jail. But the threat for more aggressive and more stringent measures could deter traffickers, producers, and consumers. However, as we can see in the yearly reports of the UNODC, this hasn't happened. So this change of approach, this paradigm towards a more progressive one, based on the gender perspective, based on public health approaches and human rights, requires new work. It requires new indicators, because negative impacts of the war against drugs are not being reflected with these indicators. All indicators can measure how strong we were, but they are not measuring how successful we were with this. With the number of people in jail, we don't know anything about the progress. We don't know if our drug policies is being effective or not. I can tell you that in the triple border of Brazil, Argentina, and Paraguay, there is a bridge that when it's crossed, the federal police has a letter saying the amount of drugs seized in this period. So seizures are not the right indicator to learn about the effectiveness of the drug policies. So what we need to do is to have new indicators in order to have more accurate monitoring to mitigate harms caused by drugs. So in this way, in this document, we are proposing or another strategy in order to have better health for the community based in the promotion of human rights. And we need to have new metrics, new measurements to identify negative effects in these interventions. We need to have other models, we need to adapt them, we need to correct them. And with these new indicators, we are going to have a better understanding, more information about the problem, because the traditional models were not giving us all this information, neither solutions for these problems.
So then, to go into women and drug policies, we know the number of women incarcerated because of drug-related crime. And you see on this table, in Argentina, Brazil, and Costa Rica, over 60% of women incarcerated because of crimes related to drugs. It's over half. So what is the debate on women who use drugs, pregnant women, and discrimination they go through? Let me tell you about jail as a response to drug use. Implementation, development, and assessment of legislative reforms on drug use has to do with criminal justice systems that have to be able to take into consideration circumstances, as for instance, of women who have dependents, as Romi mentioned, vis-a-vis the situation of pregnant women. Under no case, women accused or sentenced because of drug-related crimes that haven't been violent. I think those women should be set free. On the other hand, we know that alternative measures other than incarceration are less costly, especially when we talk about drug-related policies. Jails and their services are for the male public. They do not take into consideration, spaces or daycare centers or women that are breastfeeding their children. And many of the women do have children in jail. In Uruguay, for instance, 3 years. Children are allowed to stay with their mothers in jail 3 years, but they usually end up staying longer than that. On the other hand, it's important for legislation and drug policies to take into account conditions of more vulnerability among indigenous women and Afro-descendant women, pregnant women, women with children, and women that are breastfeeding their children, women with no protection, a lot of social exclusion. For that, we've done work with new metrics, trying to promote a specific drug policy. And when I say specific, I'm talking about policies with gender perspective. So the objective is basically analyzing the application and the impact this legislation has on women and their families through alternative measures for women sentenced because of nonviolent drug-related offenses, women who are in jail, and regional strategic expenditure for mechanisms, support, accompaniment, and the support for those women. It is very important that once these women are set free, they have a way to get a job and support themselves. As already mentioned in this panel, many of these women have family abandonment. So they leave jail and they're very vulnerable, a lot more than men. And treatment for women who have the drug addiction problem inside and outside the prison. In Mexico, we have an organization in Mexicali working with street women, with the homeless women, and they look into risk situations. We also need public policies for that, for women who are set free. So to conclude, basically, what we propose for as goals and objectives is to do away with criminalizing and stigmatizing drug users, as well as promoting more humane, efficient policies with a gender perspective, because gender perspective is so necessary, especially in this type of cases, and also promote public health policies, and also promoting practices, interventions, and programs on risks and damage for the entire population. Thank you.
Thank you, Viviana. This really close in a perfect way our interventions. I think you wrap up very properly on the several discussions we have had on the topic of drugs, on the need of talking about indicators as a basic tool to really push this change. As you recognize, traditional indicators measure how we talk. We have been basing indicators of sales, quantities of drugs, of people in jail, but we are not going to be able to measure how we are done and how we are changing this perspective. So we have half an hour for a discussion. I have very interesting questions in the Q&A. I also have a couple of questions prepared for you. So I am going to start with the first question from myself. That is on the practical side of this discussion. You were very good on talking about the challenges, about the new changes we need to implement. But we, in a previous discussion, we talked about the need to go deeper in how this is possible to do. So I am going to do a very small question in this practical topic for all of you but focusing in one topic. For example, Alejandra, I wanted to tell me, and we have like 2 or 3 minutes, please, because we have some other questions to address. Alejandra, I want to ask you about how to overcome these stereotypes on gender, on the production of data, or on the way to develop policy. So this is the focus for Alejandra. For Cristina, I wanted to ask you about the justice sector. As you indicated in the presentation, police data is well more developed than justice. And for Romi, I wanted to ask you about how practical is to collect gender disaggregated data on women who are involved in illicit drug trade. And for Viviana, I found very interesting this perspective of women in jail, in prison. How can we tackle this more in practical ways? So I will appreciate you reply fast to continue with a couple of questions I have collected here.
Sure.
We start with the order we talk. Alejandra, Cristina, Romi, and Viviana.
Gracias, Katherine. Pues siguiendo con la idea de quedarme en español, pero tú me avisas si cambio.
I will say in Spanish. You let me know if you want me to switch to English. So the stereotypes, how do we do away with gender stereotypes? If it were a simple answer, well, we would all be on the other side, right? I think that one of the most effective strategies has been to visibilize stereotypes through the documentation part of this. It's difficult to identify a foreseen stereotype, foreseen for a woman. I mean, if you don't give the contrast perspective. In the chat, someone was saying it's completely incorrect for the men to give his permission for the women to get treatment. This is from Romi's presentation. Romi can comment on this even better than myself, but this is a cultural situation. If women understand there are other contexts where they have more independence to make their own decisions over their own lives, etc., if this is possible and the bias is identified and as they are able to establish contrasts, well, this is one of the strategies to eliminate stereotypes. I don't have much time to say more, but two things: documenting stereotypes, making them evident to be able to strike the right contrast. This is an international panel, and we're talking about very different cultural perspectives in our countries. That's what I would say. I know I don't have much time, and I give you the floor.
Yes, thank you, Catherine. The assessment that we conducted on the data collected from the justice sector shows us that the data availability is even less than when we are comparing with the police sector, and the data comparability it's almost inexistent. So we saw that only 1 or 2 member states could provide data comparable according to Aguirre's indicator requirements. So it means that that the justice sector it's kind of less developed in data collection than the police sector. We were also exploring ways how to integrate both databases in order to have like benchmark data as attrition rates, that it's really important for us. But there are a lot of problems here that we have to overcome, such as the confidentiality, the data protection issues. So we are still working on the ways that we can integrate these different data collection systems to have a better picture of the data, no, the institutional response. But so far, I think that the most interesting insights that we received is that how member states have different not only data collection systems and the ways that they're registered, but can show us how the institutional response from the judicial sector kind of it's really like not coherent what we expect. For instance, when we were collecting data on the protection orders, we saw that in some member states protection orders fall under the family court, in others into the civil court, in others under the criminal court, and it was so difficult to collect data according to the different courts and according to the different protection orders. So it means that there are still a lot of contradictions between the civil decisions, court decisions, and the criminal decisions. So we are talking about integrating databases, but still we cannot integrate, or we cannot align the judicial response in the same country between 2 courts, that is the civil court that in charge of the data of the protection order, and the criminal court in charge of judging the offense. So in a sense, we saw that the data it's not available, it's not comparable, but we saw that there are a lot of contradictions within the system as well when collecting the data, and how we can improve this. Thanks, Catherine.
Thank you, Romi.
I mean, I think the short answer is that it's a very difficult area to collect accurate data on for, just gender disaggregated data on women who are involved in the illicit drug trade. Obviously, as an illicit activity, it's hidden and there's a veil of secrecy around it. So unless you are taking it through people who are actually in contact with the criminal justice system, it can be dangerous for those who are collecting the data due to the violent nature of the illicit drug trade. The problem with taking the data from women who in contact with the criminal justice system is that it's the criminalization of people who use drugs. So women who have been arrested on drug offense charges are mixed up with women who are involved in drug trafficking, drug mules, in terms of just gender disaggregated data. So the criminalization of people who use drugs, as well as the response to microscale trafficking, often linked to drug dependence, is also, the response to that is also usually imprisonment or pre-trial detention. So all of these statistics get mixed up together, and it's difficult to separate women who are just using drugs from women who are actually involved in the trade. And I think these difficulties, all they do is underscore the need to foster a public health approach to women who use drugs, rather than a punitive law enforcement approach to women who use drugs, so that the two can be separated out, and interventions and treatments and sentencing can be tailored effectively for the two different groups.
Thank you. Viviana?
Sí, bueno, creo que cuando hablamos sobre mujeres que están privadas de libertad, uno de los principales
In
desafíos
jail, one of the main challenges is methodological in terms of the generation of reliable data. We have to understand who those women are in jail. Their families, do they have any people depending on them? And labor insertion is also very important. One of the projects we've done in 2019 has to do with the labor insertion of these women in Brazil, for instance. When they are set free from jail, how can we strengthen accompaniment mechanisms, program assessment, professional skills for these women? Because the private companies sometimes hire people in jail, but they are getting no labor qualification. So they could be doing something in jail, like making dolls and things, but this is not going to help those women when they're set free. So they can be working when they're in jail, but they're not going to have the necessary skills when they get out of jail to have labor insertion or social insertion in general. These women face basic problems, documentation problems. They don't have the right papers they need, and they have to start the children custody, healthcare, housing. They have to find new territories, and they're quite vulnerable. So they need a job. They're going through processes of a lot of stigma, especially when they're just left jail. So we have to think about these metrics with gender perspective as of the situation of these women, and data we can get, reliable data, updated data. Very well. Something else, I just saw a question from Agustin Enriquez. How to fight against something that is harmful in excess, but not in acceptable amounts. It doesn't help health. The principle is to say that all excess is bad. So how can we use the word fight against? I don't think we should use this verb when we're talking about drugs. Drugs may be harmful, or they can have a positive effect on your body, and that will always depend on the reasons for which we are consuming drugs, the environment, the context we live in, whether we have information on the consumption of that substance. It's very important when we talk about drug regulation to remember that the regulation model is not the same for all substances. For marijuana, we can think of one regulation. With coke, meth is something else. So yes, of course, we need to have more scientific information on those substances and the type of model we could use in case that in the future, perhaps we can start regulating other substances as well. Gracias, Viviana.
Appreciate if you take a look to the questions, because there are some very specific, especially in the topic of drugs. So I am going to put together several questions that are there into this one. Here we are talking about gender and we focus on women. There are several questions there talking about a differentiated and an intersectional approach. We are here not talking, we didn't talk a lot about LGBT populations, and that's the broad perspective of gender. Can you please just address this topic if you want everyone or just the panelists that are interested in this topic, because we are like very few minutes to continue to close. So the one that wants to talk could raise the hand or could ask for the floor about intersectionality and LGTB populations.
Yo, en
Alejandra,
un minuto.
thank you.
Creo que existe una tendencia cada vez más creciente justo
An increasingly growing trend to analyze variables of intersectionality, for instance, the influence of race on this type of situations and the influence of gender identity, as you well mentioned. This is not simply restricted to the male or female roles, but in general terms to gender identity. There are some challenges in this, and I conclude my intervention saying that how can we approximate and measure to have a better idea of gender identity people have? This is quite a complicated thing. There's an international discussion on this. The UN is discussing this on which are the best mechanisms through which we approach gender identity. Some societies, some communities, even some countries, this is a normal situation. This is increasingly happening in terms of identity, diversity, and there are other components, however. So how can we be closer to a better way to collect information on these different groups as well said? They seem to be confronting different situations when they reach justice institutions. Is it a need? I think it is a trend. However, there's a problem, a methodological challenge in the measurement of gender identity, massively speaking.
Anyone want to complement or we continue with the following question? Please let me know in the next 3 seconds. So we keep the Alejandra's response. I am going to, it is impossible to isolate the context we are living now. And I just want to talk about vulnerabilities of women during the pandemic and during the crisis of COVID, because it has been highlighted that the biggest burden of violence in domestic setting was addressed by women. Cristina already replied this question written, but I would like to ask you, any one of you want to highlight any of the specific vulnerabilities of women during the COVID crisis, challenges to get the data, or opportunities to improve the data during this crisis?
Sí, yo quiero hacer un comentario rápido sobre eso,
Make a
Katherine.
very quick comment on this. One of the major problems has to do with stigmatizing these women. Therefore, women cannot participate in programs. They don't want to approach hospitals looking for help or treatment. There are some Latin American countries, for instance, that do have treatments out in the street and the ambulances that are touring through the cities. This is not the same, and they don't have this service in all cities. So this makes it impossible for women who are in situations of vulnerability or women that are homeless and who are pregnant. Well, it makes it difficult for them to go to a help center because of the stigma. A lot of times stigma against pregnant women, users of substances, is greater than stigma against men.
Thank you. Cristina,
Gracias.
comment on the topic of COVID crisis?
Sí, gracias. Nosotros lo que hemos visto, recogemos en los diferentes países de la Unión Europea, hicimos un
The
estudio sobre
different European Union countries with COVID-19 and the different measures enforced for greater access for women victims of gender violence. So some of the measures implemented in some of the European countries, especially measures that have to do with access to services, especially police services through new apps, new digital online tools. So that truly favored access of women that didn't have this access before. They could not file a complaint before. And since now they have access, they can do it anonymously in a more confidential fashion. A lot of those instruments that were designed or those apps that came out as of this pandemic, women are able to access, especially women that are victims, they can access this in a very fast and easy fashion, especially during the confinement. I think they have come to stay. This is a good way to gather data on the situation and access women have of those services. Now, in terms of the pandemic and the impact of the pandemic and the prevalence of violence, well, that is something we can not yet know. We are going to do it, but in the near future, in 1 year's time or perhaps 2 years from now. Surveys right now, while the confinement was taking place, were quite risky and we were putting women at risk. Right now, we're designing a survey that will perhaps be done next year as of the pandemic situation to see the influence of COVID-19 on women and vulnerability and also violence.
Thank you, Cristina. So we have now 5 minutes to close this panel. We have many interesting questions that are very specific. Just to let you know to all the participants is that we have saved these questions and we are going to share it between the panelists so they could take a time to follow up with this. I just will take these 5 minutes to allow the panelists to do any closing remarks, any specific topic they want to share about the opportunities. I think it's very important to really have this panel and to talk about the specific problematic of women and how data is the real way to highlight these vulnerabilities, risks, and perspectives. So I will take these 4 latest minutes to you. Viviana took the floor to start. If you panelists want to do this closing remarks, I will appreciate, and I will close from my side. Thank you for this fantastic panel and to the UNODC to inviting me to share this panel. Thank you, Viviana.
Gracias, Katherine. Sí, estaba leyendo acá una pregunta de Gabriela Reyes que dice...
Question by Gabriela Reyes. How feasible is for UNODC to look at indicators or change indicators when they can go against perceptions of the donor countries? This is a very good question because the truth is that changing international drug conventions is practically impossible. But I do believe these conventions have very big voids where countries may participate to adapt those conventions to have greater control on national or domestic policies. For instance, although regulation of marijuana is not envisaged in the conventions and they go against the marijuana, we have the Uruguay and Canadian where, yes, there's they regulated on cannabis. And I think looking to control public health for the entire country is more important than to accompany these conventions in detail. So we are going beyond and over those perceptions. We have to look at the indicators seeking to improve public health. This is very important, and we can adapt to existing conventions without having to change them, because for that we need a consensus agreement, and that would be quite a complicated thing to do.
Any concluding remarks?
¿Sí? ¿Alguien más?
If not, Salome of the technical side, please let us know how to proceed. Any remarks? Okay, we are done.
Well, thank you all very much, all the panelists, and of course, Katherine